So, this morning you've been hearing about the three areas that we usually inject on the upper face. So, the frown area, the forehead area, and the crow's feet area. So, now we're going to try and put this all together in a typical three-area injection. And for the purposes of this three-area injection, I have recruited my lovely wife, who has now had her last few doses of Botox fade away, so it is now time for repeat injection. It was good timing. And what we will do is we will start by looking at the muscle actions and marking out the appropriate injection sites. Now, as time goes on and you repeat injection after injection after injection, you will find that the necessity of marking is getting less and less. But I would recommend you use something like a makeup pencil and use that to mark sites of injection initially when you begin to inject, to give you sort of a habit of looking for the appropriate sites. So we are first going to start off by looking at the frown. I'm going to prep the skin with a little bit of chlorhexidine soaked gauze, and then we shall proceed to mark out the areas. Perfect. So, if you could frown for me, Sonia. Lovely. So you see there's two aspects now of this frown movement here. We have a downward pull and the horizontal creases created by the procerus muscle. And then we have an inward pull from both sides created by corrugator supercilii, which pulls in the skin of the forehead towards the central line. This creates these vertical or slightly oblique 11s, as sometimes people call them. So, if we are going to inject the procerus, its insertion point is on the periosteum of the nasal bones here. So, if we look for the radix or root of the nose, and we place a central point over the radix, that injection site should allow diffusion around the procerus and reduction of the action of procerus and stop the downward pull of the brow. If we now move on to the corrugators, frown for me, Sonia. Remember what I said about reading the movement and the lines. So if the line is in this direction here, the muscle fibers are going to be perpendicular. So the muscle fibers are going to be traveling along this direction here. So the medial corrugator, as we know, is a bony insertion. So that the point of medial corrugator injection is just above the head of the brow, and this is going to be a deep injection site. Keep frowning for me, Sonia, and relax. The lateral point of injection can be determined by asking the client to move and frown again, and you can often see the limit of the lateral insertion point with a little notch. So if we don't come right to the lateral extreme, but we come perhaps about 1 centimeter from the lateral extreme, we can get a nice point for the lateral insertion. This is going to be a superficial injection because this is where the corrugator inserts into the skin. Let's replicate that on the other side. Frown for me and relax. And then frown again and relax. Perfect. So this is a typical markup for a frown injection. I would encourage you to mark by reading muscle movement and looking at lines, rather than memorizing points such as a centimeter above the eyebrow or a centimeter above the mid-pupillary line above the brow medially, because these points are variable on people. Not everyone has a standard eyebrow position as well. If you're going to use distances, they need to be from fixed landmarks, such as bony points, rather than hairy landmarks, such as the eyebrow. What we will now do is move on to look at her forehead movement and look at the horizontal forehead lines and see how we're going to inject those. Raise the eyebrow, Sonia, and relax. Raise again, and relax. Okay. She has an even distribution of tension across the frontalis. If we are to reduce this, we ought to be careful not to come too proximate to the brow ridge, because those neuromuscular junctions are more to do with her eyebrow elevation. The upper neuromuscular junctions nearer the hairline are to do with pulling the brow down. If we come too low, that can give a fixed sensation to the client and they won't be able to move their eyebrows and can look rather fixed and inanimate on expression. So we have a safety margin of 1.5 to 2 centimeters above the brow ridge to take into account when we place our injections. So I'm going to ask you to raise again, Sonia, okay, and relax. We're going to put a central injection there. Raise again for me and relax. There's a component of movement there as well. And raise again for me and relax. Lovely. Raise again for me and relax. And one more time. Relax. Okay. Perfect. So here we have 5 points across the forehead that will help reduce the extent of forehead movement and reduce the formation of horizontal lines. If you turn slightly towards me now, we are going to look at the crow's feet area. Now, if you can give me a cheesy grin and squint for me, you see the formation of crow's feet lines. The lines are radial from the center point of the eye or the pupil, and this is because the muscle fibers are circumferential. So basically the lines are perpendicular, tangential to the line of the muscle fibers. So when marking crow's feet injection sites, relax. What I always do is palpate the orbital margin. And once I put my finger on the orbital margin and gently rest it on the globe of the eye, I know that anything posterior to that is safe for injection. So I will look at the spread of lines, big smile, and here she has a spread that is relatively uniform. Some clients will have purely upper creases, some will have middle creases, and some will have lower creases, and some clients will have a combination of those. Relax for me. I'm going to do a first point just adjacent to the line of the lateral canthus, and then a centimeter above and a centimeter below. Give me a big smile. Perfect. Those fall all along the lateral orbicularis oculi fibers. Again, now turn over to this side, and we shall ask you to contract in the same way and relax. Good. Again, I'm going to use my finger to feel the globe and the edge of the orbital margin, looking at the lateral canthus here and following the line, and then below and above. So here, as you can see, we have a nicely marked forehead, frown, and crow's feet area. So if I just scan this way and that way, we can see where we are going to inject. I have a preference of using the needle that I'm about to inject with to draw up directly from the vial through the seal. I see a lot of colleagues who do often decap the vial. Now, the vial is capped and is sterile. Decapping the vial leaves it open to particulate matter drifting around in the atmosphere, people sneezing, particles that may enter the vial and cause contamination. So I do not like personally to decap the vial. The criticism that I would receive from decappers of bottles would be that they will say, the seal blunts my needle. I do about 1,200 injections of Botox a year, and I have never yet found it to be an extensively painful procedure, and from a single pass into the bottle, as so, it doesn't noticeably blunt the needle and inhibit me from injecting efficiently. I also change my syringe for each site, and that then allows me to maintain a relatively sharp edge on my needle and also maintain the sterility of the contents of the vial. I am now going to start by injecting the glabella area. When I do this, the first injection point that I will usually go for is the central procerus point. And to facilitate the passage of the needle through the skin, I tend to isolate either side of the radix and go with a perpendicular approach and straight in to the procerus, deep, almost periosteal, and release 4 units. Now I will inject the medial and lateral corrugator from the contralateral side. This way my needle always faces away from the eye. If I isolate the corrugator and ask you to frown for me, Sonia, so I can feel the muscle bulk there and relax. This injection is deep. When I perform this injection to approach the muscle deeply enough, I will enter at a 60-degree angle to the skin and then go straight down into the deep medial corrugator, releasing 6 units. Small amount of bleeding, but nothing drastic. And you can see a little bleb that forms. This is quite typical with any Botox injection. If you come towards me slightly, this will facilitate the injection of the lateral corrugator. I will now ask you to frown again, relax, and again. The lateral corrugator has a superficial insertion into skin, so it is much more superficial than the deep corrugator. So now my entry point comes down to 30 degrees to facilitate a injection that is more superficial, popping through to the skin and releasing 4 units. So now I'm going to proceed to finish off the frown injection, and we'll be injecting the right hand side corrugator. So I'm approaching from the left of the client. So to achieve this, again, I'll ask her to frown for me, relax, get a feel for the muscle bulk forming between my fingertips, and then enter again deep 60-degree angle, release 6 units and out. You can see the little bleb that is created. And now again the lateral corrugator, and I shall be approaching with a shallow 30-degree angle, just subcutaneously, and then releasing a 4 unit quantity. So in total we've injected Sonia's glabella area with a total of 24 units. 4 in the procerus, 6 and 6 in the medial corrugators and 4 and 4 in the lateral corrugators. So now we are going to inject the forehead. And as you can see, from the forehead point of view, I'm going to not switch sides. You can if you wish, but what I tend to do is bring towards me and bring away. Whatever is done on the forehead should be symmetrical. I sometimes adopt a due north approach for each injection, because if I was to vary the angle of my needle in this direction and then vary the angle of my needle in this direction, I may slightly shift the bias of the injection to one side or the other. So by adopting a continual due north direction, we avoid any lateral bias in the injection. If I was, like I say, to continue to inject all the points as such, she would have a leftward bias in her injection. So let us proceed with our due north technique. First injection coming up. 2 units. Well done. A little bit of pressure. Again, straight up vertically here, due north. Second injection. Lovely. Followed by third injection. So 2 units per side. She doesn't have a very strong frontalis. Raise again for me. Relax. Lovely. Right over to this side. Last injection of the forehead. Perfect. So you can see all 5 points of the forehead injected. So finally, in our 3-area journey, I will come to the crow's feet injections. Very important now to understand that the orbicularis oculi muscle is a very shallow muscle. It is just below the skin. It's not too far. 2 millimeters to 3 millimeters is adequate penetration of the needle to get to the layer of muscle. If we plant the needle deeper than this, we run into situations of bleeding, bruising, and towards the lower aspect of the crow's feet, where the orbicularis oculi overlies the zygomaticus major, deep injection on the apex of the cheek may also cause fibers of zygomaticus major to be adversely affected, and as a result cause an asymmetrical smile. So you can prevent this by making sure your injection is always superficial. In order to achieve this, again, I will inject from the contralateral side. I always use my finger as a safety device which protects the globe of the eye, the gap between the globe and the orbital margin, and then anything beyond that is nicely over the bone and safe to inject. Approaching at this angle allows a virtually parallel entry point to the skin, so the needle, as you can see, is almost parallel with the skin, and it's almost impossible to advance the needle too deep. Further advancement of the needle will just cause, again, superficial placement, but more distally. So we're going to start with the first injection, literally just piercing the skin and releasing a 4-unit bleb. Again, superficial placement, 4-unit bleb. Here, as you can see, we're using the 8mm short 30 gauge needle, and even so, you can see only about 3mm of the needle penetrate the skin. And when you feel the release of going through the skin and that give that you get when you're into the area just below the skin, that is when you release and relax. So finally, the client's right-hand side crow's feet to finish off. Again, I'm coming in from the opposite side, finger of safety to gently feel the globe of the eye and bridge across to the orbital margin, creating a perimeter of safety, and then anything beyond that is safe to inject. Very superficial, almost parallel approach to the injection point, and then releasing 4 units in each site. You see me very cautiously advancing the needle, and as soon as I have the give of the skin, releasing the product. And that way you can see crow's feet, which is probably the riskiest site for developing a visible bruise, not even bleeding. And that is thanks to keeping the needle very superficial. So that concludes our 3-area injection of the client. In this case scenario, we have injected a total of 24 units to the frown, a total of 10 units to the forehead, and a total of 12 units on each side for the crow's feet. This gives us a total of 58 units of Allergan Botox injected in this particular client. Now, it is very important when putting this all together to realize that for each person you see, there is no set formula. If you become formulaic with your injections, then you will not achieve the optimal balance for each client. So right from the start, rather than memorizing patterns of dots on clients' faces, one must learn to individually read clients' faces. The way to do this is by asking the client to repeatedly animate their face and look at the face in rest and in animation, and then also look at other factors that may encroach upon your decision to inject various areas, such as heaviness of skin above the eyelids or dermatochalasis, the client's desired brow shape, structures that are nearby such as vessels that may bleed and cause large amounts of bruising. All these things will change the pattern of injection you administer. We will talk about these in greater depth later this afternoon and tomorrow, but it is important that you understand injection is a case-by-case analysis rather than a formula.